We're back investigating one of the most horrific crimes making headlines around the country. Dr. Marsha Edwards seemed to be living the perfect life, on social media anyway. But just days after posting this photo and boasting, "I could not ask for better children," she shot and killed them both. And then she turned the gun on herself. What made her snap? And were there any clues hiding in her photos that we missed? We're back with the host of Oxygen's Injustice with Nancy Grace, and I want to bring in psychiatrist Dr. Judith Joseph. So Dr. Joseph, clinically speaking, describe what's going on in the mind of a woman who would take the lives of her children. What's going on in their psyche?
Well, first of all, this is just unspeakable and tragic. And typically in cases of filicide, where you kill your own child, there's something very extreme happening. It could be an extreme mental illness, an extreme medical illness, or something that is like bankruptcy or financial crisis, something that's very extreme, causing an emotional stress. And it's quite possible that this doctor was self-medicating. We know that doctors have access to prescription medications, and she could have been self-medicating an extreme depression with alcohol and prescription drugs.
Well, why kill herself after killing her children? What's the benefit of that?
So from what we know about Dr. Edwards, she truly lived and breathed for her kids. And maybe she believed that they lived and breathed for her too. And it's quite possible that the thought of killing herself and leaving them in this world alone was just too painful for her. Perhaps she thought that she was being merciful by taking them along with her and sparing them the pain of living in this world without their mother.
So Dr. Joseph, this woman, Dr. Edwards, Marsha Edwards, took the Hippocratic Oath as you and I did, right? An oath to do no harm to anybody. Obviously, it's meant for our patients, but it also applies to our family. So do you believe this was premeditated? Or did something just go boom, wrong within 3 minutes of this all happening, and the rest is history?
So in my clinical practice, when people who are professionals, who are public figures, do something unspeakable, there's something extreme happening, be it a crisis, a shame, something that's about to come out. And they do this out of desperation. So if she truly did this, I believe it was out of desperation. There's something that we don't know.
Why, I'm back to where I started. Why did the husband, divorced 5 years, call for a security check on a home 30 minutes away? Why? The son lived there. Why? What was the issue? Why did he think police needed to go into that gated home?